cold hands, cold feet, numbness in the toes, legs that ache after walking to the mailbox. Most people over 60 have felt at least one of those, and most of them file it under getting old. I want to talk about that today because some of it genuinely is normal aging, and some of it is a warning sign that should not be ignored. So I am going to do two things in this video. First, I am going to give you 6 foods with real published evidence behind them for blood flow. And then near the end, I'm going to tell you the specific symptoms that mean you should stop looking at food and call your doctor instead. That last part is the reason I made this video. Please stay for it. Let me start by explaining what circulation actually depends on, because it is not what most people picture. People imagine arteries as passive pipes. They are not. The inner lining of every artery is a living tissue called the endothelium. It is 1 cell thick, and if you spread it out flat, it would cover several tennis courts. That lining produces a gas called nitric oxide. Nitric oxide diffuses into the muscle layer of the vessel wall and tells it to relax. When it relaxes, the vessel widens and more blood flows through. Here is the problem with age. Nitric oxide production declines steadily as we get older. By 70, most people produce substantially less than they did at 40. That is the single biggest reason circulation changes with age. So 5 of the 6 foods on this list work on exactly that pathway. Number 1 is cocoa. And this is the one with the most surprising recent research. In January of this year, researchers at the University of Birmingham published a study in the journal Food and Function. They took 20 healthy older adults, average age 72. Each person drank either a high flavanol cocoa beverage or a low flavanol one, then sat still for 2 hours. Before and after, the researchers measured artery function in the leg and the arm using ultrasound. In the low flavanol condition, 2 hours of sitting measurably impaired blood vessel function in both the upper and lower limbs. In the high flavanol condition, that impairment did not happen. The cocoa preserved the artery function through the sitting. Now, an important detail. The blood pressure rise from sitting was not prevented. Only the vessel function was protected. And I want to be very clear about what this does and does not mean. This is not permission to eat a chocolate bar. Most commercial milk chocolate has been processed in ways that strip out the flavanols, and it is loaded with sugar. What was studied was a high flavanol cocoa preparation. The practical version is unsweetened cocoa powder. Ideally, not the Dutch process kind, since alkalizing destroys much of the flavanol content. Or very dark chocolate, 70% and above in small amounts. Number 2 is nitrate-rich vegetables. If you have watched my video on arteries, some of this will be familiar, so I will keep it brief. Beets, arugula, spinach, celery, and lettuce contain dietary nitrate. Bacteria on your tongue convert that nitrate into nitrite, and your body converts it into nitric oxide. This is a completely separate production route from the one in your artery lining, and it becomes more important as the internal route declines. That is why studies in older adults tend to show larger blood pressure effects than studies in young people. 1 serving of leafy greens a day is the practical target. Number 3 is watermelon, and I want to give you the honest version of this one. Watermelon contains an amino acid called citrulline. Your kidneys convert citrulline into arginine, and arginine is the raw material your endothelium uses to manufacture nitric oxide. So the pathway is real. A meta-analysis published last year pooled 15 randomized controlled trials in middle-aged and older adults. Citrulline supplementation or watermelon intake lowered systolic blood pressure by about 4 points and diastolic by about 2.5. But here's the caveat most channels will not tell you. When researchers separated the two, the concentrated citrulline supplements carried most of the effect. A separate analysis found that watermelon intake alone did not significantly improve the vessel function measures. The reason is dose. The amount of citrulline in a normal serving of watermelon is far below what the supplement trials used. So enjoy watermelon. It is a genuinely good food. Just do not expect a bowl of it to do what a research dose did. If this is useful to you, tell me in the comments whether your hands and feet run cold. I read them. Number 4 is garlic. And this one has more clinical trial evidence than most people realize. Multiple meta-analyses of randomized trials have found that garlic preparations lower blood pressure in people with hypertension, with reported systolic reductions commonly in the range of 5 to 9 points. Aged garlic extract, in particular, has been studied for arterial stiffness. The active sulfur compounds appear to support nitric oxide production and to have mild effects on platelet stickiness. 2 honest notes. Most of that trial evidence use standardized supplements, not the clove in your kitchen. And one recent analysis found the blood pressure effect was clearest in people aged 50 to 60 and less clear above 60, likely because arterial stiffness at older ages is harder to move. Cooking garlic in your food is good. I would not expect it to replace a medication. Number 5 is fatty fish. Salmon, sardines, mackerel, herring. Omega-3 fats get incorporated into the membranes of your red blood cells. This affects how easily those cells deform as they squeeze through the smallest capillaries, which are narrower than the cells themselves. Omega-3s also reduce inflammation in the vessel wall and modestly reduce platelet aggregation. 2 to 3 servings a week is a reasonable target. And number 6 is not exactly a food. It is water. I am including it because it is the most overlooked item on this list. Blood is mostly water. When you are dehydrated, blood volume drops and blood becomes more viscous, which is to say thicker and harder to push through small vessels. And older adults are far more likely to be dehydrated for 2 specific reasons. The thirst signal weakens with age, so you genuinely do not feel it the way you used to. And many older adults take diuretics, which increase fluid loss by design. Now, I am not going to tell you 8 glasses a day. That number has no strong evidence behind it. And if you have heart failure or advanced kidney disease, you may be on a deliberate fluid restriction. Follow your own doctor's number. But if you have stopped drinking during the day because you are worried about getting to the bathroom, that trade-off is worth discussing with someone. Now, the part I promised you. Please listen carefully because this is the most important minute of this video. Not all poor circulation is a nutrition problem. There is a condition called peripheral artery disease, or PAD. It is atherosclerosis in the arteries of the legs, and it affects roughly 10% of people over 65. The classic symptom is called claudication. That is, cramping or aching pain in the calf, thigh, or buttock that comes on when you walk and goes away within about 10 minutes of resting. If that pattern sounds familiar, that is not arthritis, and it is not age. That is a blood flow problem, and it needs to be evaluated. Now, here's what concerns me most. Studies in primary care have found that a large share of people with PAD have no classic symptoms at all, or have atypical ones like heaviness or fatigue in the legs. Many older adults simply walk less, so they never trigger the symptom, and it gets misattributed to knee arthritis or back trouble constantly. The test is simple and takes minutes. It is called an ankle brachial index, and it compares the blood pressure at your ankle to the blood pressure in your arm. Ask for it by name if this describes you. And here is why it matters far beyond your legs. PAD is not a local plumbing issue. It is a signal of atherosclerosis throughout your body, which means a substantially higher risk of heart attack and stroke. Finding it changes how aggressively your whole cardiovascular risk gets managed. Now, some symptoms are more urgent than that. Please treat these as reasons to seek care promptly rather than to change your diet. Swelling, redness, warmth, or pain in one leg, but not the other, can indicate a blood clot in a deep vein, and that is a medical emergency. Sudden severe leg pain with a cold, pale, or numb foot can mean an artery has become acutely blocked, and that is a call for emergency help immediately. A sore or wound on the foot that is not healing, especially if you have diabetes, needs to be seen quickly rather than watched. And numbness or tingling in both feet is more often nerve-related than circulation-related, commonly from diabetes or a B12 deficiency, and both are worth testing for. None of those are food problems. 3 honest statements before I close. The evidence for these foods is mostly about blood pressure and vessel function measurements, not about curing cold hands. Most of the impressive effect sizes come from concentrated supplements in research settings, not from ordinary portions at dinner. And this video is education, not medical advice. I am a physician, but I am not your physician. But here is the honest hierarchy, and I would rather you hear it from me than believe the food list is the whole story. The strongest interventions for circulation are not on this list at all. Not smoking is first, by an enormous margin. Walking regularly is second. And for peripheral artery disease specifically, supervised walking programs are one of the most effective treatments we have. Controlling blood pressure, blood sugar, and cholesterol comes next. And breaking up long stretches of sitting matters more than most people believe. The cocoa and the greens are real, and they are worth eating. They are just the last 10%, not the first. Tell me in the comments whether you have ever heard of the ankle brachial index before today. I suspect almost none of you have. Take care of yourselves, and I will see you in the next one.